We're going to discuss how do we treat obesity. Now that we have established in an earlier section that we need to treat obesity and the reasons for treating it, now comes the solutions. Obesity treatments can be categorized into 3 different sections. The first section, I would want to say physician-directed non-surgical methods. Typically, the very low-calorie diets, meal replacement diets will come into this section. Second one would be non-surgical endobariatric procedures. These are procedures that can be performed that does not involve surgery or incisions or anesthesia for the most part. And third thing would be the bariatric surgical procedures or weight loss surgeries such as a lap band, gastric sleeve, or a gastric bypass, or some of the other procedures that we offer and perform. Under the physician-managed non-surgical solutions, the most important one is a VLCD program, which is a very low-calorie diet, and that's a meal replacement program. In our practice, we use a New Direction VLCD program, which has been proven to have excellent results. Once we put the patient on a VLCD program, maybe for 10 to 12 weeks, and they have accomplished significant weight loss that we initially set as our goal, then we're going to transition them from a meal replacement medical nutrition therapy into slowly introducing regular foods along with some of the other dietary supplements, and that would be considered as a low-calorie diet or an LCD. And we also use pharmaceutical intervention as needed. So for example, if somebody is on a VLCD and starting on a really good New Direction program and doing well with it, however, they have significant hunger that they couldn't control and it's a little difficult to stay on track, then we can employ different FDA-approved medications to help curb their hunger so that they can stay on track with the VLCD program and therefore be able to accomplish the goal that we set out to do. The New Direction VLCD program that we offer for patients had been applauded as one of the best VLCD programs out in the country with proven and excellent results. In the non-surgical endobariatric solutions category, we have procedures that can be performed that do not involve surgical incisions. And these are procedures that are offered as an option for the appropriate patient. And the most common one is a gastric balloon. Think about a balloon that is placed inside your stomach and we inflate it to a certain size, taking up volume or space inside your stomach. Therefore, the purpose is to reduce the amount of food you can eat because the balloon already takes up some of the volume in your stomach, and it can also keep you full for a longer period of time. However, these balloons need to be removed after about 6 months or so. So the balloon weight loss will serve as a very good starting point or a jump start, so to speak, for weight loss. Patients may lose 40, 50, 60 to 70 pounds in a 6-month period using the balloon weight loss method. Individual results, however, may vary. There are 3 types of balloons available at this point. Orbera is a type of balloon, Reshape is another one, and Obalon is a third type of balloon that is offered. Overstitch is also a different procedure that involves endoscopic suturing. So maybe we can reduce the size of the gastric pouch with an overstitch procedure, or sometimes we may be able to make the opening smaller in an overstitch procedure. In our practice, we offer the Obalon gastric balloon procedure. This is the first and only FDA-approved swallowable balloon system. Yes, it is swallowable, meaning that this balloon comes in about the size of a normal fish oil capsule kind of size. So the patient would swallow it, and once they swallow the balloon, we would do an X-ray to verify that the position of the balloon is actually inside the stomach. And once we verify that, then we inflate the balloon and patient goes home or goes back to work. So this procedure takes maybe 10 or 15 minutes at the maximum from start to finish. Does not involve anesthesia and does not involve any other post-operative recovery period. Once the balloon is in place, patient can go about a normal work pattern. We typically put in 3 balloons per patient, each one roughly spaced about a week apart, depending on the patient's schedule, as well as how they're feeling after the first balloon. So once the 3 balloons are in place, that constitutes full balloon placement for that patient. Then we're going to follow up with an excellent and very close aftercare program monitoring for this patient. And 6 months later, after successful weight loss, we're going to go endoscopically and remove these balloons. And this is an outpatient procedure.